The first one is about supporting infection prevention and control in your workplace. And there's certainly nothing that I'm about to say which is innovative, and there's certainly nothing that I'm about to say that you haven't heard before. But I think it's impossible to talk about responding to an influenza pandemic without talking about infection control. That is how you respond to an influenza pandemic, with infection control. And I want to sort of frame that comment by talking about a bit about how an influenza pandemic is different from SARS. Many of you will be very aware of the SARS outbreak here in Toronto in 2003, many other places, and how one of the major strategies for dealing with SARS was about isolation. Let's figure out who has SARS. Let's designate some SARS hospitals. Let's designate some SARS wards. Let's put people who we think have SARS there. If we think people have been in contact with them, let's either ask or force them to be quarantined. And it's about containing the virus. We know that none of those strategies are working or were even really attempted with an influenza pandemic. Influenza is rooted in the community. It has a grip on the community. And so how community organizations respond with infection prevention and control will end up determining what the story of H1N1 is. So even though the virus probably has been in all of our workplaces already, and even though we may be facing high rates of absenteeism, and even though there may be increased pressures on our organization, we need to come up with other strategies to sort of plow through the influenza pandemic rather than contain it. So a few of those strategies are infection prevention and control strategies other than quarantine. And obviously the number one is hand washing. And I know you've heard this from more people than just me recently, but it really is both the cornerstone and the centerpiece, if that's possible, of an influenza pandemic response. You know, it's very socially unacceptable now in the vast majority of workplaces, if not illegal, to smoke in our workplaces. However, in many organizations, people are actually encouraged and incented to come to work when they have a cough and a fever. New research that came out just this morning, American research, but saying that 84% of employees feel pressured to come to work when they're sick. Let this be the pandemic that turns the culture of that around. That when people are coming to work when they have cough and a fever, they're doing more harm than good. We need to be supporting that through policy that incents people to stay away from work when they're sick. We need to be supporting that through example from leadership, through music, if that helps. We need to be supporting that by telling people to get out of here. You're doing more harm than good when you're coughing and have a fever when you're at work. You know, there's been a lot of discussion lately about, why is there such a big deal about H1N1? How is this really different from any other seasonal flu season that we've been dealing with? And that's a very legitimate question and discussion to have. One of the reasons, of course, why it is different is that we normally have seasonal vaccine available in advance. And as you all know, we don't yet have a vaccine for H1N1. So when it does become available, and however it does become available, I know that drama is unfolding, but when it does, it'll be important for community organizations to support that public health intervention by partnering with health organizations to make it available to staff and clients. I said a minute ago, let this be the pandemic when the culture of coming to work when sick ends. Let this also be the pandemic when workplaces finally figure out whose job is it to do the dishes, whose job is it to actually clean that workplace kitchen. Does anyone around here actually sanitize doorknobs? I hear it happens, but so in some workplaces, yes, some workplaces, no. Let this be the pandemic when it gets nailed down. Whose job is it to sanitize doorknobs and to sanitize countertops and phones and keyboards, and does it actually happen? Supporting infection prevention and control is the first good idea. The second good idea I want to talk with is the planning and improvising good idea. I call that plan for a best guess, and don't forget that it's a guess. A lot of people disagree with what I'm about to say, but I think it's true, so I'm going to say it. I don't think you can simply insert an influenza pandemic plan and hold it inside a general emergency plan in an organization. I think there are enough things that are different about pandemic influenza that make it very different from a bomb threat or a blackout, that it needs to at least be its own separate piece of paper. But even if you have the luxury of saying, yes, we need a specific response to that, that doesn't mean you're going to be able to cover the whole range of possible scenarios with an influenza pandemic. So the piece of advice here is don't try. Don't try to cover all the possible scenarios. It is worth taking a best guess on what we might be facing. And one of the reasons why, and if you want to be conservative about it, make a best guess and plan for something slightly worse than that. One of the reasons why I think it's worth taking a best guess is people find it helpful to be able to picture what's it going to look like to walk into your organization during, if we're talking about the second wave, during the second wave of H1N1 or during an influenza pandemic in general. Am I going to turn up for work and find out what my job is each day, or am I generally going to do the same job I usually do? I've been involved in a few evaluations in different community health centers, evaluating how they responded to the first wave of H1N1. And part of how they did that evaluation was a survey of their staff. And in all of those surveys, there was a consistent finding, and it was that staff said, wasn't it good that we had a committee in place? Wasn't it good that we had a plan in place? Now, I thought that was very interesting because none of those organizations implemented their plans. They didn't need to. H1N1 was not serious enough to match the assumptions of their plan. But something in the planning process built up the confidence and the competence in those organizations to be able to improvise effectively. Dwight Eisenhower said, planning is everything and plans are nothing. And I think that's exactly what was happening in those organizations. The planning was very useful. The plan didn't end up being useful at all. Now, I want to stress here, many of you will be familiar with the Myers-Briggs type indicator. It's a personality tool. Do people know that? Some people know that. And one of the dimensions on that tool is planning versus judging. It's around sort of when you make decisions and how comfortable you are with changing the plan partway through. All I want to say here is, I'm saying you need to be able to change the plan partway through. I'm saying you absolutely have to be able to rip up a plan. Some people are going to be more comfortable with that than others. The third good idea I want to talk about, if that one was all about, what was that about? That was about planning for a best guess, and don't forget that it's a guess. The third one is develop your own plan and partner in your response. I think it's worth having a time in the planning process when you really zero in on your own functions and how you're going to face the risks that you know you're going to face. And during that planning time, it's against the rules to say, what if the TTC shuts down? Or what if Toronto Public Health tells us to do this? Or what if Loblaws can't access any food at all? To really be insular, to take the time to look in your own organization and figure, what are the risks we think we're going to face and how are we going to deal with them? And also have a time when you're looking out at what's going on in the community around you and partner. And whether it's the right thing or the wrong thing, we know from the research that most of that partnership develops during the response rather than before. One of the resources I've suggested is 5 good resources. Just an article by a researcher named Capuccio describes how 1,600 nonprofit, community-based nonprofit organizations were involved in the response to the World Trade Center disaster. And 70% of them said that they responded in partnership. Now, I don't think the article says this, but I'm pretty sure none of those organizations had a plan for what to do if both towers of the World Trade Center get attacked by planes and comes down. They figured that out in the moment. They figured out how to partner, and they did that in the response. So having a plan based on their own response and responding in partnership. Fourth good idea. Clarify organizational priorities and roles during an outbreak. This is the business continuity good idea. This is more important for scenarios of high absenteeism, and, which obviously are more likely for small organizations. It's worth, I want to go through a few steps here. It's worth being very clear in sort of more emergency-oriented pandemic situations. What are the things that we absolutely must keep doing from a service perspective, from a program perspective, or must start doing at that point? Having a manageable list based on high absenteeism. If you don't have the capacity, what are the things that we could do? Now, lots of organizations have said, we need to keep doing everything, but we're only going to be able to do it for fewer people, and so let's figure out how we're going to make decisions about the fewer people part. On another Another important step can be figuring out behind the scenes. For a few week period during the peak of a wave, maybe even just a couple of weeks, what are the behind the scenes things that must keep going or must start? And trying to come up with as small a list as possible there. And the one thing that every organization has told me is on top of that list, at least those who have employees, is payroll. That if you don't have payroll continuing, then you don't have an organization. So coming up with a manageable list of services, a manageable list of behind the scenes things that have to happen, and then figuring out what are the roles it would take to do those things, and do we have enough people who have the skills to fill those roles, and what sorts of training needs to happen to fill those roles. That's sort of a skeletal, bare minimum organization based on what you're currently doing and what you think you might have to add on. I would also argue and many organizations have done this, assigning some roles now. We're not in an emergency now, but we are in an enhanced alert here in Ontario. That was declared in April, and that hasn't changed. And a number of organizations have assigned roles now. A pandemic manager, a final decision maker on all things related to the pandemic, and a backup for that person. One of the things that many organizations have said to me about SARS is that we were absolutely overwhelmed with information. And you know what? It's happening again with H1N1. We're being absolutely overwhelmed with information coming in from all sorts of sources, most of which isn't relevant to us, but we need to comb through it. And so many organizations have said, yes, we know that's one of the things that's challenging about this. Let's make that part of someone's job, an information coordinator, to regularly be going through the information coming in. A safety coordinator, making sure that there are people on the health and safety committee of an organization who are really oriented to this health and safety risks associated with pandemic influenza. Now is the time to prepare to assign those types of roles. So clarifying organizational priorities and roles during an outbreak, that's the business continuity good idea.